Now, just to give you a slight warning ahead of the next discussion we are about to have, we are going to talk about baby loss and trauma. Just in case that is something that might upset you, you might want to turn away for a few minutes. But having a baby is said to be one of the happiest moments of your life. But as many as 1 in 5 women experience some kind of anxiety or mood disorder, either through pregnancy or when their little one arrives. I completely get that. To be honest, I'm thinking, why is that number not maybe a bit higher? I've had 2 little ones myself, and I've seen what my incredible wife has gone through pregnancy, through the early years as well, because they have to give absolutely everything. They give their bodies. They have to give absolutely everything they have for their babies, and they do a tremendous job. Well, today is World Mental Health Awareness Day, a day to highlight these feelings and to say it's okay not to be okay, because there's people on hand to help, and you are not on your own. Merseycare's Silver Birch hubs are one of those places to turn to, and clinical psychologist Moninne McCormack and specialist midwife Natalie Patterson are with us on the programme this morning. Good morning to you both.
Good morning.
Morning.
Good morning. So 1 in 5 women have these feelings, but many go undiagnosed or don't seek help. What are the reasons people might not say how they're feeling? I'll come to you first, Moninne.
I think a lot of stigma. It's a really silenced and untalked about difficulty. As you said, it's supposed to be the happiest days of your life, and often that's just not the reality for lots of women, because alongside the happiness, there's sadness, fear, excitement, and if your expectation has been that maybe you'll breathe your baby into the world and that hasn't been the reality, which it isn't for most people, that can really be at odds with your expectations. And it's just to say that, the transition to parenthood, as you've said, is a really big transition. It's not how it's portrayed in social media, so that can feel really alone. It's a very isolating time. And then alongside that, if you've experienced a trauma or your baby hasn't come home with you, that, as you can imagine, that makes it a really, really difficult time for people.
Yeah, of course it does. Of course it does. Is part of the perception when women have babies is that, and don't get me wrong, I'm not saying it's not a happy time, because undoubtedly people have incredible moments, bringing life into this world, loving their babies. And I suppose, do people maybe, particularly on social media, get a snapshot of the cuddly shots, of the smiley shots, and think, they must be delighted they're having a brilliant time, when the reality is that is not what it is like to have a baby all the time, is it? Is there a perception that you should be over the moon because you've got your baby?
Absolutely. I think that's put out there, as you've said, in social media. And as in anything with social media, we know often it's always just like the good things that are portrayed and not the more challenging or difficult things. So in the way that we can talk about maybe physical changes that happen in pregnancy and after childbirth, we're maybe not as a society as good at talking about those kind of emotional changes and those adjustments that need to happen. Because becoming a parent, whether it's for the first time or the 5th time, is a change. It's a change in that family dynamic. It's a change in your life and the impact that it has. And that can be a big adjustment. And for some people, if they've been through trauma or loss, that can add to the difficulties they might have and that impact on their mental health.
And Natalie, it is such an overwhelming thing to go through, isn't it? Physically as well as mentally. These feelings are certainly understandable. And we've heard terms like postnatal depression before and baby blues, even those kind of terms maybe people would have heard of. But do others really fully understand what they mean unless they've gone through it or seen it?
I think it can be really difficult for people to understand. And we work with women and birthing people who have got a diagnosis of PTSD, so post-traumatic stress disorder. And I think that's something people often don't associate with pregnancy and childbirth. But actually we know the impact for some people can be that it is a really traumatic experience. And as Moninne said, we also work with women who've experienced loss. So you've got that grief and that trauma alongside, and that can be really difficult. And I think unless you have been through that, it can be really difficult for loved ones, family members, friends, even wider society to really understand that.
And if one of you could just tell me a bit more about Merseycare's Silver Birch hubs, because, I mean, this is being dubbed as one of the places to turn to, somewhere where mums can reach out and get that help, or maybe, you know, dads can reach out on behalf of mums or people who know mums. Tell us a bit more about what Silver Birch hubs do.
So we work with women and birthing people who've experienced trauma or loss in the fertility, maternity or neonatal experience or period. And so we work with people who are experiencing that, where it's having a really significant impact on their day-to-day lives. But there's lots of services that sit alongside us. You know, we have a no wrong door policy. So if someone was referred into us and they weren't appropriate, there's a specialist perinatal teams, there's talking therapies, there's lots of brilliant charitable and third sector organisations locally as well that we would always signpost to.
And just very quickly, sorry to interrupt, we've got the news coming up in a second. I just want to say, how can people find Silver Birch hubs? Is it online? Is there a number?
So they can go to our website, Silver Birch Hubs Maternal Mental Health Service and Merseycare. And if they are struggling, or if you notice your loved one is struggling or a family member, just encourage them to talk to their GP, their midwife or their health visitor, and any professional can refer them into our service.
Thank you very much. Clinical psychologist Moninne McCormack and specialist midwife Natalie Patterson for joining us this morning. And if you're affected by anything that we've been discussing there and you feel like you do need to reach out to someone beyond Merseycare's Silver Birch hubs, there is always the BBC Action Line. Just go to bbc.co.uk/action line and they will point you in the right direction.